مساء الخير. مع حضراتكم دكتور وائل شنودة، مدرب معتمد مجلس الإنعاش الأوروبي والمصري، مدرب الزمالة المصرية، ورئيس قسم السموم. هنكمل سلسلة البويزنينج باي أنيمال بويزن. Snake poison. 5 families of snakes all over the world. Colubrida, Cortilidia, Ellipate, Hydrophate, and Fibrate. The venom apparatus of the snakes. Venom apparatus of the snakes consists of secondary venom duct, accessory gland, primary venom duct, and protective sheath and fang. Snake venom, blood coagulant like thrombin and prothrombin-like substance, anticoagulant, agglutinins, cytolysins, protolysins, antibactericidin. Affect the blood component as well as the endothelium of the vessels, paralyzing the phagocytic activity of white blood cells. Neurotoxins A and B affect the cardiorespiratory higher centers and the central nervous system. Neurotoxin B also affects the myoneural junction. Cholinesterase and anticholinesterase affect the myoneural junction. Cardiotoxin stimulates the heart and causing dysarrhythmia. Hyaluronidase facilitates the tissue spread of the venom. Severity of inflammation. The species of snake involved, its age and size, the number and depth of bites, and the total quantity of venom injected. The location of bite is of a great significance. Venomous snakes bite on the head are 2 to 3 times more serious than those on the extremities and the trunk. Bites on the upper extremities carry a worse prognosis than those on the lower extremities. Incidental penetration of the fangs and the injection of venom into a blood vessels is usually catastrophic. The age and the size of the victim and their general state of health. Not all strikes by snakes result in inflammation. So-called dry bite may occur in up to 30% of cortolite bites, 50% of ellipse bites, and up to 25% of sea snakes bites. Toxic manifestation, local toxic effect, hematological effect, neurotoxic effect, cardiotoxic effect, and other toxic effect. Toxic manifestation, local toxic effect. The corticoids and the fibrates result in significant local toxic effect, like pain, swelling, edema occur soon after the bite. In severe cases, the edema progresses rapidly within several hours. The site may become ecchymotic and discolored. Vesicles may also appear, which are usually filled with clear fluid, but may become filled with blood in severe cases. Local tissue necrosis may also occur, which is probably due to direct action of venom's enzyme. ده منظر السنيك بايتس، وده منظر الإديمة اللي حصلت. وفي الصورة اللي تحت احنا شايفين الإيكيموزيس وشايفين انها filled with blood. Hematological manifestation, ecchymosis and extravasation of blood, bleeding from the kidney, lungs, peritoneum, rectum, and the vagina may occur as a result of endothelial damage of small vessels and lymphatic channel. Changes in red blood cells and their ability to transport oxygen may result in bleeding. Decrease in hemoglobin and tissue anoxia, leading to necrosis, really hypofibrogenemia with or without thrombocytopenia. Disseminated intravascular coagulation, DIC, and fibrinolysis can occur. Neurotoxic manifestation, the effect of neurotoxins A and B on central nervous system manifested by dysphagia, convulsion, occasionally psychotic behavior. The myoneural junction is also affected by neurotoxin B, which result in locomotor disturbance manifested by weakness of muscles, fasciculation, paresthesia, and very extreme cases paralysis. Cardiotoxic manifestation, cardiovascular shock. Shock results from increased capillary permeability, which leads to intravascular volume depletion. Reduced cardiac output, secondary to venom-induced cardiac changes. In addition to the release of mediators such as bradykinin, histamine, serotonin, may also contribute to hemodynamic compromise. Other toxic manifestation: elevation or depression of temperature, nausea, vomiting, diarrhea, pain, restlessness, tachycardia is frequently seen than bradycardia. Renal failure from acute tubular necrosis and cortical necrosis has been reported. Late complication of snake inflammation, tissue necrosis and sloughing, fibrosis with limitation of movement. Differential diagnosis of snake venom. Differential diagnosis of snake bites include puncture wounds and abrasion from other causes, wound infection, cellulitis, DVT, DIC, thrombocytopenia, inherited bleeding disorder, and septicemia. Diagnosis: lab diagnosis of snake venom poisoning focus on detection of coagulopathy, hemoconcentration anemia due to extravasation of erythrocyte, rhabdomyolysis indicated by elevated creatine phosphokinase value, hematuria and hemoglobinuria on urine analysis. يعني العيان اللي جاي لي بادعاء سنيك بايتس انا بعمل له السي بي سي عشان اشوف الهيموكونسنتريشن انيميا، هعمل له الكواجوليشن بروفايل، هعمل له الكرياتين فوسفوكاينيز عشان اشوف الرابدوميوليسيس، يورين اناليسيز عشان نشوف الهيماتوريا والهيموجلوبينوريا، وطبعا رينال فانكشن. المانجمنت اوف سنيك بايتس: فيرست ايد keep the patient calm and in the supine position. The bitten part should be immobilized and kept independent position. Patient calm, supine position, bitten part immobilized and kept independent position. Reassurance and sedation is necessary to treat psychic trauma. Light constriction band about the swelling that admit a finger beneath it. It is commonly recommended to prevent lymphatic spread of venom and not to occlude the arterial blood supply. It should be removed 2 to 3 minutes every 15 to 30 minutes to avoid the ischemic affection. Don't make incision because it may increase the damage to tissue at the site of bite. It is recommended only in the unusual circumstances where medical help is offered 30 to 40 minutes away. Should be parallel along the long axis of the limb. Through the fang marks about 1 centimeter in length and not deeper than 3 millimeter. Don't use oral suction. It is lead to infection. Don't apply ice. It leads to vasoconstriction, ischemia, and partial damage to the tissue. Specific measure anti-venom. عندنا 2 من مضادات سم التعبان، monovalent وبوليفالent. Monovalent is specific for a special type. Polyvalent against 2 or more species. Antivenom is the life-saving treatment is given to neutralize the snake venom. It is derived from hyperimmunized horse serum. The available Egyptian antivenom is polyvalent 1, derived only from the Egyptian snakes. Children should receive the same dose of antivenom as adults. Antivenom should be given as intravenous drip from 2 من 2 ل 15 vial or more may be used depending on the severity of inflammation. Prior to administration of antivenom, sensitivity test is done to avoid the hypersensitivity reaction. So subcutaneous injection of epinephrine should be available to avoid any possible anaphylactic reaction. Symptomatic and supportive measurement: tetanus and toxin, adequate fluid, oxygen administration, blood transfusion and fresh frozen plasma, intravenous calcium gluconate to control convulsion, broad-spectrum antibiotic, local injection of lidocaine may relieve pain, corticosteroids are indicated in management of serum sicknesses and to prevent allergic response to antivenom. Daily cleaning the wound with hydrogen peroxide. Scorpion poison. Scorpions are a nocturnal animal. Scorpions feed primarily on insect spiders and occasionally on other scorpions. Component of scorpion venom: protein component, non-protein component. Protein component, neurotoxins and minimal enzyme, phospholipase A2, which is responsible for hemolytic action, acetylcholinesterase, hyaluronidase, non-protein, histamine, 5-hydroxytryptamine, serotonin. Toxic manifestation. Local evidence of a sting is sometimes minimal or absent. Mild tingling or burning at the site of sting may progress up to the extremities. Neurotoxic result from its effect on the activation and inactivation of sodium channels, result in release of catecholamines and acetylcholine. Excessive release of catecholamine, which can result in myocardial damage and congestive heart failure. Arrhythmia and pulmonary edema have also been reported. Priapism, persistent painful erection of penis, unaccompanied by sexual desire or excitation. It is a very common finding in scorpion sting, but its exact mechanism is unclear. In severe cases, spasm in throat, feeling of sick tongue, restlessness, muscle fibrillation, abdominal cramp, convulsion, incontinence, hypertension or hypotension, oliguria, cardiac arrhythmia, pulmonary edema. Management. First aid: immobilize the patient and the bitten part immediately. Apply a constricting band to limit absorption of venom. Give artificial respiration with O2 if respiration is depressed. Apply cold pack for the first few hours to help slow absorption. Antivenom therapy: inject specific scorpion antiserum. It is derived from hyperimmunized goat serum, route by intramuscular injection. If there is no response with half to 1 hour, the dose can be repeated up to 3 ampoules intramuscular injection. In severe cases, 1 to 5 ampoules can be given by slow intravenous drip method. Supportive measurement: control convulsion. Diazepam may be useful. Inject calcium gluconate. Inject a local anesthetic to area of bite to relieve pain unless the bite is on a digit. It is a case study, and I wait for your answers and discussion on the chat. Thank you.